Hey everyone, it's Maddie Miles. I'm back with the second piece of What the Health is Going On. For those of you that don't know me, I'm a junior human health science major at the University of Kentucky. If you aren't familiar with my podcast prior to this one, I do a lot of health law legislation research and I have a really strong passion for understanding healthcare and how we can make our country better. But for this segment of What the Health is Going On, things are going to be a little different. With the help of Dr. Robin Brown, I am learning how social movements play a role in our healthcare system. So take a few minutes to dive in with me and learn something new. Okay, so before we start, I think it's really important that we all understand what a social movement is. Because I know that whenever a lot of people think of it, like sometimes people get really defensive and think negative things like left and right movements, things like gun control, abortion laws, things like that. And whenever I say we're going to talk about social movements in healthcare, those aren't really the things I'm talking about. The dictionary defines a social movement as a group of diffusely organized people or organizations striving towards a common goal relating to human society or social change or the organized activity of such a group. This definition might seem like a little hairy, but if you break it down, essentially what it's saying is that it's a group of people that get together to reach a common goal. So, thinking back on how this could relate to healthcare, social movements are extremely important because not only do they help improve healthcare, but they can really shift how we do things in research. They can bring attention to overlooked causes, they can bring in funding, influence political change, they can do all kinds of different things. So ask yourself, have you ever participated in a social movement? I know whenever I was asked that, I was like, no, I haven't participated in a social movement. But then thinking back on it, I've participated in so many Susan G. Komen breast cancer walks. I've donated to March of the Dimes. These are all social movements for healthcare. And so, for anyone out there that's like, this is boring, I do not care about this, well, you should care, and here's why it's important. So, staying static in healthcare is really bad because there's constantly new disease, we have a changing population, and that means that we have changing needs. So, it's really important to push the limits of science and healthcare to bring about change and to bring attention to these important causes. So, I hope that kind of eliminates the idealism that social movements aren't always extremely radical things to change. Social movements are often things we participate in all the time. So, as I mentioned, a health social movement is typically a group of people seeking change in healthcare. There are different types of subtypes of health social movements, such as health access movements, embodied health movements, and constituency based health movements. The first one, health access movements, is identified as a group of people seeking equitable access to healthcare and improved provision of healthcare services. These include movements such as those seeking national healthcare reform, increased ability to pick specialists, and extension of health insurance to uninsured people. A really great example of this is the University of Kentucky. UK has done a really great job identifying health disparities in the Appalachian region of Kentucky, so eastern Kentucky, and they've opened up various outreach programs and funded different things such as cardiovascular centers, physical therapy centers, and places where health access is difficult. The next subtype is an embodied health movement. This, by definition, addresses disease, disability, or illness experienced by challenging science on etiology, diagnosis, treatment, and prevention. Embodied health movements include contested illnesses that are either unexplained by current medical knowledge or have environmental explanations that are often disputed. An example of an embodied health movement would be the AIDS movement from the 80s. The AIDS epidemic spread so quickly and so violently that people were scared to even hold hands with people or use public toilet seats. We'll get more into this social movement later in this episode, but basically the takeaway message is that people were looking for answers for this unexplained phenomenon, and they wanted research for it. The last subtype I'm going to talk about are constituency-based health movements. These, by definition, address health inequality and health inequity based on race, ethnicity, gender, class, and/or sexual differences. These groups address disproportionate outcomes and oversight by the scientific community and/or weak science. They include the women's health movement, gay and lesbian health movement, and environmental justice movement. And just like a real quick FYI so I don't get sued, all three of those subtype definitions came from the Social Movements in Health and Introduction article written by Dr. Phil Brown and Dr. Steven Zasavsky. So first we're going to start out talking about the AIDS movement from the 1980s, but really it had been along way before then. It's just that the Center for Disease Control didn't identify the HIV virus, which turns into AIDS, until 1981. And while Ronald Reagan was president, his administration famously refused to even mention the word AIDS until 1985, almost 4 years later. By then, though, the epidemic was huge and there was no way to ignore it. We're going to spend a lot of time talking about this because I don't think people understand the progression we've made in only 40 years. The point is, though, is that as this disease was making its rounds through the gay community, these people were being discriminated against. I mean, if that happened now, it would be a lawsuit waiting to happen, and deservedly. The point is, though, is that doctors were refusing HIV and AIDS patients, and while nurses were afraid to even bring them lunch or to touch them or treat them. It's really disheartening to put yourself in someone else's shoes and imagine being in that situation. I personally cannot imagine going to the hospital and just being shamed for something that I don't even know how it happened or why it happened to me. Anyway, so we're going to listen to an interview with Dave Francis, and he's going to describe at that time what it was like being at ground zero of the AIDS epidemic in New York City.
Set the scene for us of what life was like in the early 80s in New York City when this thing broke.
The first thing you have to know or remember if you're in our generation is that gay people, lesbians, gays, and transgender population were really excluded from the larger culture. And there were no protections in place. In the United States, it was illegal to be gay in 23 states in 1981 when the first reports of the plague hit. And it was illegal for people to enter the United States even as tourists if they were gay people. So we were in a kind of a prehistory, and the population, the gay community, was very isolated and kind of inward looking when the virus hit, and because of that, there was very little coverage of what was obviously a mounting problem.
So, kind of setting the scene, it's kind of crazy to think about because we have this full blown epidemic against a community that we pretend didn't exist in the 80s. I mean, gay marriage was literally illegal in 23 states, and the US didn't even let in gay foreigners. So, as I mentioned, Ronald Reagan was president and really had founded his campaign on Christian values and had really grown a strong following from Christian sectors. Whenever the AIDS epidemic broke out, people were calling it gay cancer, and because of this, we're really being reluctant to make laws to help do research and to prevent this because they really were happy with what it was doing, which is really sickening to think about. They were glad it was killing gay people. And I know that's a really strong statement to make, but literally people would say that this is what God intended, that he was punishing a bad community. So, I mean, I don't know what else other way there is to explain that.
Every bill that came along, he attached to every bill with AIDS funding in it what he called the Helms Amendment, which kind of colloquially was called the Helms Amendment for the next decade, that neutered and nullified any piece of legislation that was looking at raising money for AIDS research or HIV prevention campaigns. And he was doing it in the name of morality. And in the name of morality, condemning to death tens of thousands of people.
Okay, so you get it. At this point, it was literally the LGBTQ community against the world. And so, with literally zero funding, zero support from almost anybody, this community set out to make a change.
Before anybody even hypothesized that it was a virus, the gay community came up with a plan for containing the epidemic, promulgated it among itself without any funding from any government authorities, and they invented something they called safe sex. Now, safe sex is a term we all kind of think existed forever.
No, but it didn't. It came from then.
It was actually invented and published in booklets and passed around so that people could understand ways to theoretically protect themselves. And what we see after the advent of safe sex in 1983, 2 years into the epidemic, and it had simultaneous creations in Toronto and New York and San Francisco and Los Angeles, this idea that condom usage and avoidance of exchanging certain bodily fluids might contain the spread of the disease. We see the indices of all sorts of other diseases dropping off remarkably. Gonorrhea collapses in the community, syphilis collapses in the community. We know that safe sex was taken up, and a really like large scale behavioral change took place within the community.
Hey, so if you learn anything from this, it's that the term safe sex literally came from this social movement. I can't tell you how many times as a future healthcare provider and as a college student that we've used the term safe sex in health education. So now we're going to listen to Dave talk a little bit more about how this social movement grew and transformed over a span of 5 years from 1980 to 1985, and how this was organized to a movement called ACT UP.
The other part was to try to get, in your country, Congress to flow money to the National Institutes of Health so they could find a cure.
Right.
To that end, tell us about ACT UP. What was that, and what role did it play?
So ACT UP is a kind of a newcomer to the political movement of activism that started right at the beginning. And it's a slightly younger generation, maybe a half generation younger than the activists that took to the ground in 81. It's 1987, 6 years into the epidemic, 500,000 people worldwide already dead. The president has just said the word AIDS for the first time. And he described it not as a scientific problem, but a moral problem. So
this is Reagan.
This is Ronald Reagan. We, as a community and as a movement, had no traction 7 years in, and no pill. You said they were looking for a cure. They were looking for treatment, anything, and nothing had been released. Think of it, 6 years of sitting and waiting for pharmaceutical companies, anybody, to at least try something. And the frustration was understandable and profound. And in early 1987, a group of people got together in New York to express their fury, and they formed the nucleus of what would become this international grassroots social justice movement around healthcare called ACT UP.
So really what we're seeing here is a pattern of oversight and just overall ignorance of what is happening in the United States in healthcare. Without much effort, we can identify this as an embodied health movement, since it's a group of people looking for treatment and prevention and trying to find an explanation or a solution to an unexplained phenomenon. This phenomenon obviously being AIDS. Another really unique part about embodied health movements is that the people that participate in them are not always ill, but they're people that may feel more susceptible to a particular disease. So in this case, the AIDS epidemic was really making its rounds around the gay community. And therefore, even though, like I mentioned in the interview, that 50% of the community wasn't necessarily sick, but they felt like they should partake in it because they felt more susceptible. We can also identify this social movement as a constituency-based health movement since it showed sexuality differences. The gay male community was more prevalent to it than the straight female community, for example, which was really a health inequality. All in all, it's really scary to think about how this was only 40 years ago when there was all this discrimination and disparities in health, but at the same time, it's also really great to think how progressive the last 40 years have been. It's also really crazy how much of an effect it's had on healthcare and science in general. When little was known about AIDS, activists really had to engage the scientific community in order to get change for treatment and prevention. It may not be obvious at first, but sociology and healthcare really go hand in hand. Think of any major social movement in the last 100 years and how it could really relate to healthcare. Things like gun control, abortion laws, these things can relate to healthcare through contraceptive devices and things like mental illness. No matter what side you're on or what you believe, it's evident that social movements play a really huge role in healthcare, as seen from the AIDS movement. Social movements in healthcare can change health access, quality of care, disparities, equality, belief systems, research, and practice. Without people taking a stand and trying for a change, healthcare would remain static. And as I mentioned, this is really bad because with new disease, a changing population, and changing needs, we must evolve along with it. So do your research and get involved to understand how sociology can really affect healthcare. Well, that's all I've got for today, guys. Thanks for listening. I'm Maddie Miles, and this is What the Health is Going On. Special thanks to CNN Health News. The Agenda was Steve Paikin for the interview. The Journal, Social Health Movements with Dr. Brown and Dr. Pisetsky. And special thanks to my mentor, Dr. Robin Brown. Thank you, and tune in to the next episode.